Hi, my name is Debrah England. I'm one of the advanced midwife practitioners in the emergency department at the Rotunda. I've been working in the Rotunda since 2004 and in the emergency room for about 8 years now. It's a busy little unit. We could see 80 to 100 patients in a 24-hour period. Yeah, it's a busy little department. You come and you're assessed or triaged on how urgent the triage midwife deems that you are to be seen in the department. Okay, well, we see everybody in the emergency room from 6 weeks to term plus 14 usually. We see babies from 0 to 14 days as well. So any complications that you're having in your pregnancy, anything that you're worried about, usually we would always advise you to ring first, would be the best thing. So we can advise you most times over the phone without requiring to come in. So we advise you, sometimes we will advise you to go see your GP, sometimes we'll advise you maybe something simple to take some paracetamol if it's pain. And we might say ring back in a few hours, but we'll always advise you what to do. So it's best to just call, or we have an automated service in the emergency department. If you ring through, you can listen to, there's a few different options. If your complication, let's say, is early labour, if your waters have gone, you can ring through and you can listen to the automated service. But if you want to speak with any of the midwives, you can ring at any time. The line is open 24 hours, 7 days a week. Probably our most common presentation to the emergency room in early pregnancy would be PV spotting and pain. We would tell anybody with spotting or pain to come, especially pain, to come to the emergency room. PV spotting, we can refer to the early pregnancy unit, but if it's heavier than spotting or bad pain, you should attend the emergency department. We also see complications such as hyperemesis that develop usually around 6-7 weeks. We can see them in the emergency room also. We would have sometimes people coming to the emergency room in early pregnancy with symptoms such as, feeling weak. Sometimes it's just a drop in blood pressure that can happen, and we would advise them to usually see their GP, increase their fluid intake. Like I said, just to give us a call first, and we can direct you over the phone. Yeah, we would advise you to come if you have severe morning sickness. So it's quite a common presentation that we would have to our emergency department. Usually what happens is you come in, we check your urine first to just see what level of dehydration you have. Then we assess and decide on that and how obviously sick you're presenting. Usually what we do is we keep you in our emergency department. Over a few hours we give you a drip, some IV fluids, and we take some bloods just to check all your levels to make sure you're not too dehydrated. So we give you some fluids in through the drip. Sometimes we need to give you 1 bag, 1 litre, then we might need to give you a second litre. We usually give you an injection, for an anti-sickness injection, which usually helps. And sometimes people don't need this level of intervention, but sometimes they do, when especially if it's a recurrent hyperemesis that is ongoing for a few weeks. So you get seen by the midwife first. Usually they put in your cannula, give you some fluids, hydrate you, and then you're seen by the advanced midwife practitioner or one of the doctors in the department. And a decision then, sometimes we need to admit you overnight to, if you're still feeling unwell after the fluids and you're still vomiting, and usually we kind of give you a trial of maybe a cup of tea and some toast or something to eat. If you're still feeling unwell, you get admitted overnight, and generally you go home the next day. If you go home, sometimes we send you home with oral anti-sickness tablets. Pick up the phone, call us if you're concerned, or present. If you're worried, we're open 24 hours. Like I said to everyone leaving the emergency room, if you're concerned, just come back to us. Pick up the phone, ring us, come in. 7 days a week, 24 hours, we're there.